You know, we need you to be confident as a nurse. That's why you need to practice this how many times?
5.
Yeah, at least. You can practice more, that'll be great. And then, like I said, display confidence and then be organized. Okay? And be within the time frame. We will have the table set up like this for you, and I hope I have everything on here. I guess I'll find out as I'm going through. All right. You can come on in. Can you sit up here for me, please?
Sure.
Hi, my name is Jillian, and I'll be your nurse today. What's your name?
Katie.
Katie, nice to meet
Nice
you.
to meet you.
And I saw that you were able to walk in here with no problems. Are you having any pain or discomfort today? Okay, and you were able to get on the table with no problems. You look nice and clean, and I'm saying this because it's my inspection. I don't notice any odor with you, and you're dressed appropriate for the weather. You walked with no problems, no signs of distress, and I would get your vital signs at this time, but we're just going to pass that right now. Okay? All right, and you were able to answer me and tell me your name. Do you know where you are? Where are you?
I am in the assessment line.
Okay, and do you know the date by any chance?
I do. Today is April 18th,
Okay, what's the year?
2012.
Okay, good, we can go with that. Okay, during the entire assessment, and I'm going to wash my hands now. During the entire assessment, I'm going to assess your skin as we get to each area, okay? So I'll be doing that, and I'll look at it, I'll inspect it, and then I will also palpate it, which means to touch it, okay? All right, and did you happen to go to the bathroom before we started?
I haven't recently, no.
Okay, do you need to go before we start?
Thank you.
All right, well, let's get started. So I'm going to start by looking at your head here, and I'm just looking at the shape, and I'm kind of feeling around as I'm looking to make sure your scalp is movable. Is that painful at all?
No.
Your hair is soft, and your hair looks clean.
Don't look too deep.
Okay. Looks clean. I don't notice anything, right?
Okay.
Okay, so that looks pretty good, no problems there. Your hair is distributed evenly. You notice any problems there? Yes, no hair loss, or are you having any hair loss there? That is more than normal. Okay. All right, let's look at your face. Okay, so I'm going to assess your nasolabial folds, your palpebral fissure, just looking for symmetry there. Okay? And then I'm going to move my paper down so I can remember everything. Then I'm going to palpate your temporal arteries here. And I'm sorry I'm in the way. You all may have to come around. Okay? And can you open your mouth for me? Good. And can you just move from side to side? And open and close your mouth. Good. Very good. No problems noted there. Okay, and I'm going to get you to close your eyes, and this is what you're going to feel on your face.
Okay.
And if you can just tell me when you feel it, just say now.
Okay.
Okay?
Now.
Good job. Okay, can I get you to smile? Can I get you to frown? It's kind of harder. Can I get you to raise your eyebrows? Can you close your eyelids for me? And don't let me open them. Very good. All right, what else do I want to do? Oh, can you show me your teeth? All right, and can you puff out your jaws for me? And I'm going to try to. Good. All right, now we're going to go straight to looking at your eyes, okay? So I'm going to look at your eyes here, and I know I have you kind of turned to this, okay? So I'm just looking at your eyebrows that are even. I'm looking at your eyelashes. I'm going to use my fingers here to pull down your eyelids, your sclera and your conjunctiva. I don't see any problems there, no redness. Do you have any soreness or anything in your eyes? Your pupils look equal and round. Very good. All right. I don't notice anything there that's abnormal. I'm going to assess your lacrimal glands and ducts, okay? So these are going to be your lacrimal glands here, right through your eyebrows and your ducts here. Any soreness or anything there that you've noticed? Okay, so now you are right where you need to be. If you could just step right down here,
Sure.
and I'm going to get you to do a couple of things. Do you wear glasses or contacts? Oh, good. All right, so this will be easy. All right, so I'm going to get you to hold this and just cover one eye for me.
Okay.
And I think I'm going to start, let's just start here on the third line.
Okay.
So can you tell me what you see?
TOZ.
Okay, what about this one?
LPED.
what about this one?
EDFCZP.
Okay, you're doing good. What about this one?
FELOPZD.
Great. What about this one?
DEFPOTEC.
Very good. Let's go one more. What about this one?
LEFODFCT.
What? Can you do that one more time?
LEFODP, or no, I think it's a P, CT.
Very good. So you actually were 2015.
Yeah.
Yeah. I mean, which is great because you can see better than what we consider the average person.
I'm a
Okay.
little farsighted.
Okay. Well, then, okay. Well, we'll check the other in a minute. Okay. Now I would have you cover the right eye, but I'm not going to right
Okay.
now. And then I would actually have you read with both eyes.
Okay.
Okay. While you're uncovered there, can you tell me what color this is?
Green.
And what color is this?
Red.
All right, very good. You can sit down there for me. Thank you. All right. So the next thing we're going to do is check your near vision.
Okay.
All right? And there are some words here. So we're going to hold in. Let me put about 14 inches from you. And I just want you to read this top line for me.
Heart is held in good light 14 inches from eye.
Okay. So that's good. We'll take that.
All right.
All right, looking pretty good. All right, the next thing we're going to look at is we're going to do a couple of tests here. All right, and I'm going to have you look just straight ahead, okay? Okay, continue to look straight ahead. Very good. Continue to look straight ahead.
Am I supposed to blink?
If you do. I mean, you don't have to hold your eyes open, but yes, if you, I'm looking to see if you have a blink reflex there. All right, so the next things we're going to do, we're going to do a couple of tests here, okay? I'm going to have you to, when is the test? Oh, yeah. Let's, before we do this test, I'm going to have you just cover one of your eyes with your hand, okay? Then I'm going to step up close to you, and I'm going to bring my fingers in, doing my fingers like this, and you tell me when you see
Okay.
my fingers. I want you to look straight at me, okay?
Okay.
Ready?
Now. Now.
No, no.
Now.
All right. All right, and we would do the same thing for the other eye.
Okay.
Okay? All right, so now I'm going to get you to follow the tip of this pencil, okay?
Okay.
Without moving your head, just your eyes.
Okay.
Ready? Very good. Your eyes going very smoothly. I didn't notice any difficulties there. Okay, the next thing I'm going to do is have you just look straight ahead, just to that wall for me. And then I'm going to have you look at this pencil. Okay, now look straight ahead again and look at this pencil. Very good. Okay, and I'm just going to shine this light in the middle of your eye, middle of your nose, I should say. And I'm going to see where the light shines on both of your eyes. Okay, so you look straight ahead for me. That's a little big. Let's get a smaller light. Okay, let's try this one more time. And I'm just looking for the light to shine in the same place on both of your eyes. And I noticed that it does. Very good. All right, and the next thing we're going to do is have you, I'm going to turn the lights down a little bit here. That's pretty good. Okay, so I'm going to have you just look straight ahead again.
Alright.
Nice, quick reaction in both eyes. Excellent. Looking at how your pupil reacts. And now I'm going to look inside of your eye, okay? So I'm going to have you, first of all, I need to set this for you. Okay, and I'm going to get you to look straight ahead again.
Alrighty.
I always have you looking straight ahead. Looking for the red reflex first. I'm sorry, I know you started blinking. This is what I saw in your eye when I looked in there. The background was like a lighter pink, and I did see the vessels, your veins and arteries meeting at a place. I did not see your disc though. And yes, but that's okay because the light's on for when your eyes aren't dilated. You're okay, yes. All right, so we're going to go straight to your ears. So I'm going to inspect your ears, and then I'm going to palpate them, okay? Thank you for turning the light back on. So I'm going to palpate here the helix. Do you have any pain? The tragus?
No, ma'am.
And I'm sorry, my hands are freezing. And also the mastoid process to see if you have any pain there. And you did not have any pain, right? Correct? Okay, we're going to perform 2 tests. The first test I'm going to do is called the Weber test. I'm going to strike this tuning fork and I'm going to put it on your head. And you tell me where you hear the sound, okay?
Okay.
Which ear or both.
Okay. Both ears.
Do you hear it equally? Okay. All right. And the next test I'm going to do is the Rhine or the Renee, depending on who's saying it. I'm going to strike this tuning fork again. I'm going to sit it here on your mastoid process. When you stop hearing it, let me know. And I'm going to move it in front of your ear. And when you stop hearing it, let me know. Okay? Too many instructions? Or
No, got it.
Okay. So I'm going to get you to move your hair back a little here. Okay, perfect. Okay, you did hear the sound. I'm expecting that you will hear the sound through air twice as long as through bone, and you did. Very good, because I was looking at the clock as we were doing that test. Okay, so now we're going to look inside your ears. And are you having any pain or anything at your ears? Or in either of your ears, I should say. Okay, well, I'm going to look in this ear. So I'm going to pull your ear up and back. I think I'm going to get you just to lean it there, just a little. I hope I can see. Can you reach? Okay, your eardrum is nice and pearly gray. You have no wax in your ear.
Thank you.
Or I didn't see any. And the canal did not redden or anything. Do you use anything to clean your teeth?
No.
I know you don't. Okay. Well, it looks really good. All right, so we're going to go straight to looking at your nose. And I'm going to use the same little light here just to look inside your nose here. I'm going to look at the mucous membrane and everything just to make sure there's not any redness or anything. Now, are you having any soreness? Are you blowing your nose? Are you having sinus problems? That was like 3 questions. Okay.
Just occasional blowing my nose.
Okay. So I'm going to have you tilt back just a little bit. You know that's how it happens. You must be a nurse.
Oh, yeah.
Okay, so inside it was a little pink, but not bright pink or anything. The hairs look good. I didn't see any sores or any polyps or anything. And it looks like, let me look one more time. Well, let's get in your nose here. I was looking at your septum. It did not look deviated.
Oh, good.
Okay, which is a good thing. All right.
Because of it.
Yeah, I had to go back and look. Okay, I'm going to assess your sinuses, and you said you don't have any sinus problems right now?
Not right now, no.
Okay, so I'm going to touch them here. So we have your frontal sinuses and your maxillary. Any soreness or anything there? All right, very good. Or pressure. There. All right, what I'm going to do is get you to close your eyes.
All right.
And first of all, before we start, I'm going to close one of your one of your nares and breathe for me. Any difficulty? Okay, and the other one. Very good. Now I'm gonna get you to smell something. You tell me what it is,
Okay.
okay?
Strawberry.
Oh, that's great. That is what it is. Okay, try this one.
Alcohol.
All right, good job. All right, so now we're gonna go to inspecting your lips and your mouth and everything. And so what I'm going to do is use the light again. I'm gonna look in your mouth. And then I'm going to palpate. Oh, it's okay. Okay, so let's look and see where we are. So I want to look at your lips first, just to make sure they're nice and moist. They look good. All right, and then we're going to look on the inside here. And can you stick your tongue out? Let's see. Can you say ah? All right. Do you have tonsils?
I do.
Okay. I'm going to get you to open up just a little wider here. Let's look here. I don't see any tonsils. Swollen tonsils. That's good.
Oh.
I don't see any. You don't even have a +1, which is good.
Okay.
Have you had a sore throat or anything?
Not for a while.
Okay. Can you stick your tongue out for me and just move it back and forth, side to side, up and down? Very good. I should have done something else while we were in here.
I have a very hyperactive
Okay.
cat reflex.
Okay, I'll go very slow. Okay. Oh, there we go. Very good. That's what I was looking for. And then let's palpate your lips and your tongue. Okay? I'm going to stick my glove finger in and just palpate around and palpate your gums, which look good, by the way.
Oh, thank you.
Your teeth as well. And we're going to palpate your tongue and your palate. Very good. And you didn't gag. See? You did a good job. Okay, now we're going to assess your, it's okay. We can just get some more. Now we're going to assess your taste.
Told you I want the
Hey,
water
Beaver,
beaker.
do you mind getting another cup of water and some
I
She
told
didn't hear
you.
me, she didn't hear me. And some salt. Thank you so much. Okay, we'll come back to that. Okay, no problem. We will, I'm going to just inspect your neck here. Okay, and then just hold it straight for me like you normally will hold your neck. Then I'm just looking to see, just from here, if I see any distended vessels or veins, which I should not see. I don't see any lumps or bumps or anything that looks abnormal there. Okay, so I'm going to palpate your carotid artery. Now, oh, and it's nice and strong. And then I'm also going to listen. I'm going to listen with the bell of my stethoscope. And it just sounds like a heartbeat. I didn't hear any abnormalities called bruits or anything there, so sounds good. The next thing we're going to do is look at your, oh good, thank you. Such a good nurse. All right, let's go on and finish with your lymph nodes, okay?
All right.
Okay, so I'm gonna start touching you for a moment here. I'm gonna go down your lymph node chain, or cervical lymph node chain, to see if I feel any swelling or anything. Okay, so I'm starting with your occipital. And then your post-auricular. And then your pre. I'm making you, And then let's go right here to your submandibular and your submental. And then I'm just gonna palpate all the way down this chain here. And then I'll palpate a little bit deeper. Okay, and on the other side as well. And I'm not feeling swelling lymph nodes. And supraclavicular. And then infraclavicular. Good. All right. And we're gonna assess assess your thyroid, and then we'll come back and have you assess for taste. Okay, so what I'm going to do, stand behind you here.
Okay.
I'm gonna get you to turn your head, a certain way. In fact, before I do that, why
It's
don't
from
you
the
swallow
drinking
just a
fountain
little bit for
already.
me? Can you swallow a little
Sure.
bit? Let's look at it. Okay, do you have any thyroid problems? that you're
Not that
aware
I
of?
know of.
Okay, I want you to, okay, I'm gonna have you turn your head to the left, turn a little, and then bend to the front, just a little bit, okay? I'm gonna push here, and then I'm going to feel on the left side. All right, now let's do the same thing. Bend a little bit. And can you swallow a little bit for me? Let me feel. Okay. Good job. I don't feel any abnormality. Very good. Okay, so I'm gonna have you hold this water again, because I'm gonna get you to taste a couple of things,
All right.
okay? But I need you to close your eyes,
All right.
okay? And then just tell me what you taste. And you already took a little water, so I assess your swallowing then. Oh. Okay, can you open your mouth for me, stick out your tongue? Okay. Taste anything? All right, very good. And, oh, I think I'll leave this one for the other side. Can you drink a little bit of water for me? All right.
Should I close my eyes?
Yes, please close your eyes. All right, and stick your tongue out. All right, very good. Okay, and while I'm back here, because I would have been back here from your thyroid, so we'll just pretend like I was back here.
All right.
And let's assess your lung fills. So what I'm actually going to get you to do is turn around so that they can see your back.
Oh,
Our assess. You can do that, very good. Okay, now we'll move your hair here. Okay, so I'm inspecting your back, and since your shirt is pretty fitted, I think we'll be okay, all right? So I'm inspecting to see how you're breathing, to see if I see any masses that look abnormal. I'm also inspecting the lateral side as well as the back side. A couple of things we're going to do now. I'm going to have you take a deep breath in and out. Good. And another one, please. Good. Now what I want you to do is say 99.
99.
Okay, again,
99.
again.
99.
Okay, one more time.
99.
Okay, very good. All right, and now I'm going to palpate. And what I'm going to do is, as I'm palpating your lungs, if you feel any pain or anything, please let me know.
Okay.
That feels good. This is your free massage for the day. And I'm palpating lateral as well. Okay, any pain there?
No.
Okay, now I'm going to percuss the lung fills. All right. Let's go lateral a little bit here. And on this side. Okay, did you have any pain or anything?
No.
All right, and the last thing we're going to do is listen to your lung fills.
All right.
All right, so every time I put the stethoscope down, I want you to take a deep breath, okay? And if you start to feel lightheaded or anything, please let me know by screaming or pulling my arm, whatever works,
Okay.
okay? Okay, take a deep breath in and out for me. Are you okay?
Mhm.
Okay. do you have any respiratory problems that you know of? Turn around again so we can get in front. I thought I heard a wheeze, that's why I went back to one area, but when you took a deep breath again, everything sounded clear. Okay? All right, so we're gonna do the same thing in the front, okay? So I'm just going to inspect first. I'm gonna move your hair back here. And if you have a little respect. Oh, okay, but your skin feels warm. And I don't notice any abnormal breathing or anything. Okay, so I'm gonna get you to take a deep breath in for me. Good, and down here. Okay, can you say 99?
99.
Good. Well, we'll go one more time here.
99.
And let's go over here.
99.
Good. Okay, so I'm going to, percuss, okay? And, yes, I got a couple of things. Okay. I'm gonna start here. Let's start over here. I'm percussing actually. Let's go here. Now palpate. So I like to palpate first and then percuss. And I can feel the little people thing.
Mm-hmm.
But no pain, correct?
No.
Okay, and just here. Well, we've already assessed lateral, so I'll just skip to interior. Okay, and then we'll have you take deep breaths again. Okay, and again, if you feel lightheaded or anything, let me know. Okay, so I'm actually gonna start up here.
Okay.
All right, take a deep breath for me. Good. Okay. Okay, now we're gonna go straight to your breast exam. Can you get the breast? Yeah, it's in the cabinet under there. Okay, so what I'm going to do is inspect your breast in various positions. So I'm just gonna have you sit with your hands down to your side. Okay, now raise your hands above your head. All right, and then put your hands on your waist, and then push your hands together. All right, and then lean forward for me. Okay, very good. All right, the next thing we're going to do is palpate your breast. Yes, we're going to do that.
There's one more.
The lanes, I guess.
Yes, we haven't gotten there yet. When she lies down, I will. Yeah. All right, so we're going to, I'm going to get, because I'm going to palpate your breast, I'm going to get you to lie down.
Sure.
Okay. And it really is funny.
What's up there?
I know the breasts are way over there. And what I would do is actually the sixth position is I would raise your shoulder a little bit, okay, and then turn this way. And this will be our sixth position. Okay? So I'm going to, thank you so much. So I'm going to move this so you can see a
I'll get
little
out your
bit.
testicles too, don't worry.
Okay, Jessica, thank you, I appreciate it. Let's come around, I'll come around here. Uh-oh, the stethoscope's in your hair.
I know. I didn't want to knock water over again, so I just
Oh,
left
no.
it.
Here, I can actually get rid of the water. There we go. Okay. So, let's assess your breast. Now, have you ever had lumps or anything that you were told, or any abnormalities of your breast? Okay, so I'm going to start way out here, actually under your arm, and I'm just going to, you're sliding.
I'm sliding?
Yes.
Oh, I'm sorry.
You're good. And I'm just going to go in a circular motion here. And with deep and light palpation all the way around. Okay. Huh? Yeah, you can't feel it otherwise. All right, no problems noted.
Good.
Very good. So do you mind if I fill some lymph nodes under your arm? Okay, so we have a couple here. Ooh. I'll be very gentle. We have central, okay, and then we have anterior, and then we have posterior, I'm sorry, posterior, anterior, and lateral. So it's 4 there. And then we have your epitrochlear as well, which is about right here. And I don't have any abnormalities there. Thank you. Okay, you get to lay down for a minute. While you're lying down, I'm actually going to go in and inspect your heart here.
Alright.
Okay, so I'm just inspecting to make sure that the chest is beating normally and I don't see any abnormal movements of your chest, and I don't. Then we're going to palpate 5 areas first. Anterior, posterior, then the epitrochlear, and then the tricuspid, and the mitral. Okay, so those are our 5 areas. And I'm going to listen in those same areas, okay? Each area sounded normal, the word I hate to use, but I didn't notice any abnormalities there, okay? All right, we're gonna go and inspect your abdomen, and maybe I'll come around to the other side so everybody can see. So I'm just inspecting your abdomen, all right? I'm not gonna touch it at all until I inspect. And I noticed that it looks flat. Do you mind pulling up your shirt?
No.
Will that be okay? Okay. Your abdomen is flat, and I don't notice any problems there. All right. Then we're going to auscultate your bowel sounds, okay?
It's fine.
Did you eat anything today?
I did.
Okay. And about how long ago?
What time is it? Maybe a couple hours ago.
Okay.
Am I cereal on there?
I can hear it. All right, and now I'm going to listen for your vascular sounds, okay? I'm going to turn to the belly of the stethoscope to do that. Look at this, if you already heard it. Okay, you had active bowel sounds, and I didn't notice any bruise there. Let's see, now we're gonna do some percussing, all right? And so we're gonna start with the abdomen, and then I'm going to percuss the liver and the spleen and the bladder, okay? You ready? Okay, very good. All right, we're gonna percuss the liver a little bit here. And I'll use this, have a tape measure on here. Okay, so what I'm gonna do, I'm just gonna put your shirt up just a little bit more here. I'm going to assess like the size of your liver, okay? So I'm gonna start and move up. Okay, did you hear that, Jennifer? And this is where your, you have kind of a long
Torso.
You do. Okay. And we have about 6.5 centimeters, which is within normal limits. Very good. Now we're going to palpate some things here. So I'm just going to palpate your aorta. more arteries, okay? Okay, very good. Ah, good reflex, wow, thank you. Okay, now I'm going to just palpate. Okay, so I'm gonna do light first, and please let me know if anything, if you're having any pain or anything. I'm gonna go down just a little deeper here. No pain? Okay, good. All right, so I'm gonna palpate your liver and your spleen and your kidneys, okay? So the first thing I'm gonna have you do, I'm gonna put my hand
Okay.
under your back here. I'm gonna have you take a deep breath for me. All right, and let it out. All right, and then I'm gonna have you just turn just a little bit this way, just, just a little bit here. And I better press your spleen too, over here.
All right.
Let's do that. I guess I will change your sound, and that's okay. Okay. All right. So I think we are done. Now I must assess your penis and scrotum.
Okay.
Okay.
Careful.
I will.
On the other side.
Oh, okay, your scrotum. So I'm just inspecting for any, sores or any lesions or anything, any bleeding, any tears. Okay, and then I'm gonna just use my two fingers here.
Ow.
Oh, I'm gonna go gently because it shouldn't hurt.
Okay.
And it, the scrotum, when I'm assessing the scrotum, the testes should feel like a little egg
Okay.
and movable and not hard at all. Okay, good job. I'm sorry I hurt you.
That's all right.
Okay, now I got a couple other things that I want you to do. Can you sit up for me without any problems? Can you move up pretty fast? All right. We're going to inspect your lens now. Okay. Let's see. What do we want to start with? Let's just start with your arms here.
Oh.
So I'm just going to inspect, and I see that you have some freckling here on your arms, but your skin looks tan. That's good. Let's look at your fingers here. I like your nail polish.
Thank you.
You do have a little cut here. Do you know what happened there?
Yes, work. This scar's from work. That's from work.
Oh, you're a construction worker?
Yeah.
Oh, okay. Let me assess. I'm going to assess the skin on your legs and feet as well while we're here. Okay. All right, and mole,
Yes.
and that's been there?
Yes.
Okay. All right, and as I was touching your feet, I noticed that they were a little cool, but your arms are pretty warm. Yeah, a little bit. Okay, good. So I'm going to have you, let's do capillary refill, which, let's see. This is what I would do. Let me show you. So we'll just press here, and we'll watch for the blood or the color to turn back pink.
Okay.
Okay? All right. Let's see, did we do everything else? Varicose veins, we would also assess for, like if you had on shorts. Okay? All right, now let's look, do a couple of tests. First test we're going to do is the Allen's test.
All right.
So I want you to take this hand and just kind of do like this for me. Okay, now just close your fist. All right? All right, now open your fist for me. And you see how the blood just returns there? Okay, I'm going to do it one more time. I'm going to have you do that again. And just, okay. And then, okay, open your hand. So okay, very good. So what I did was depress your ulnar artery first, and then your radial artery, just to see if you would get blood returned back to your hand if one was occluded. And you did a really good job.
Thanks.
Okay, can you do like this? And you'll hold this for like, let's say 30 seconds.
Okay.
Do you have any numbness or tingling? Okay, good. We're checking for carpal tunnel.
All right.
All right, so I'm gonna get you to do a couple of things.
Sure.
Okay, can you do like this? Okay, can you do like this? Okay, very good. And one more test I'm gonna have you do. I'm going to have you hold your arms out, okay? And then I want you to touch your nose with each finger first. Yes, let's do it first. Now I want you to do it with your eyes closed.
Okay.
All right, very good. Okay, and can you close your eyes for me?
Mhm.
Okay, so I'm gonna put something in your hand, and I want you to tell me what it is, okay? So let's start with this hand.
Paperclip.
Very good. And can you tell me what that is?
A key.
All right, and with your eyes closed, I'm gonna write a number in your hand,
Okay.
and you tell me what it is, okay?
A 2.
Okay, and what about this side?
A 3.
All right, very good. Okay, the next thing we're gonna do, is my cotton ball. I must have lost it in the water. We'll get another cotton ball.
That's it?
okay. Yes. So we're gonna do some light and some sharp and some dull
Okay.
touch, okay? So this is going to be sharp, okay? This is going to be dull.
Okay.
Can you tell the difference?
I can.
Okay, so I'll have you close your eyes, and I'm gonna start from the top and go all the way down.
All right.
Okay, so you tell me if it's sharp or dull.
Sharp. 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 Dull. Sharp. Dull. Dull. Sharp.
And then I'll go all the way down your legs and to your feet.
Sharp. Dull.
Okay, very good. And we're gonna do the same thing with the cotton ball. You just tell me when you can feel the cotton ball, okay? And we've already done this on your face, so we'll just do your extremities
Okay.
now. Okay.
Down. 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 Down.
Okay. And we would also assess your legs if you didn't have GE. Okay, so now we're going to assess your pulses. Okay, we've assessed some pulses already, but we're gonna continue on, okay? I'm gonna start here, brachial, or brachial. Okay. Go on and do. Good. You can rest your arm down.
All right.
Okay, very good, pulses. And your popliteal, I will feel here.
Okay. Good luck.
And your posterior tibialis, here. And on the other side. These are not as strong as the ones that were upper, but they're normal. Okay, and let's assess this side. Okay, got your pulses done. The next thing we're going to do are your deep tendon reflexes.
All right.
Okay, and so we'll start here.
Okay.
So you just rest your arm. Yeah, that's right. Just go limp there. Okay. And the next reflex, you can just relax. Let's try that one again. All right. And then this one. Okay, and then we're gonna assess your knee. And I would assess both sides. And your Achilles here. And you get, just rest your foot right there. Good. Let's assess you. All right. I'm gonna get you to do a couple of things here. So while you're sitting, why don't you try to run your heel down your shin? Let's see. All right, and can you stand up for it? And I'm gonna get you to do walking with your heels touching your toes. So like in a straight line, so they gotta touch.
Oh.
There you go. Now walk on your toes for me. All right, walk on your heels for me. Do some deep knee bends. Can you do deep and even? Okay. And I want you to stand here.
Okay,
I want you to hold your arms out with your hands up,
okay.
okay? And close your eyes for me. Oh, you can open your eyes. Yeah. And while you're doing that, I'm also going to get you just to stand here with your
Okay.
hands to your side, okay? And why don't you close your eyes for me?
Okay.
Okay, good. No swaying, looks good. All right, so I'm gonna assess your spine. So let's go over here a little bit. I'm just inspecting here, and I'm going to palpate a little bit here just for tenderness. All right, let's see what we got here. I'm gonna get you to lean down for me and just have your arms just hang loose there. Do you have a history of scoliosis that you know of?
Not that I know of.
Okay, you can stand up. We're going to, any pain?
No.
Okay, very good. Now I'm going to do a whole bunch of tests, okay?
All right.
So range of motion while you're standing.
All right.
So I'm gonna have you, move your head from one shoulder to the other, and then front and back. Okay, again to the side. Okay. All right. I'm gonna have you, raise your shoulders. Okay, put them down again. All right, very good. I'm gonna have you raise your arm up. And the other arm. Okay, again. All right, I'm gonna get you to bend your arm for me. And back, the other one. Okay, again. Very good. Okay, I'm going to get you to open your fingers and close them. All right, again. Good. Open your fingers and close them. Okay, again. All right, and squeeze my fingers, please. All right, very good. Okay, you may have to hold on here.
Okay.
I'm gonna get you to just push one leg out. And then the other. All right, now we're gonna do it to resistance.
Okay.
All right, good. Now kick one leg out and the other leg. Okay, to resistance. Don't fall. Okay, and then I'm gonna get you to bend your knee up and the other one. Okay. All right, and I'm gonna get you to bend forward again
Okay.
and bend back.
All right.
All right, and side to side, just bend over to the side. Good. Okay, now try to bend back again.
Open back.
Yes. Okay, forward. Good. Okay, you can sit down for me. Okay, now I'm going to get you to bend your foot down and up. All right, up again, down. All right, the other one. And down. And I think we have gotten all your joints a little bit. Okay, we're done with your assessment. Do you have any questions?
No, thank you.
All right, we're all done. All right, how long did I take? I don't even know what time I
Like
started.
49 minutes.
Okay.